Hi everyone, my name is Sona Rapetian. I'm a nurse practitioner student at United States University, and this is for Nursing 572 course. Here is the view of the room. Let me do it this way. And I'm going to set this down. Perfect, please, perfect. Do I have your permission to record this video for grading purposes? Yes. And upload it onto YouTube? Yes. Perfect, thank you so much. It was verbalized that my patient consents to this video being recorded and uploaded. Before we get started, I'm just going to ask you some questions. If you can, I'm just going to want to identify you. What's your name and last name, please?
Dina Addition.
And your date of birth?
11/27/93.
Thank you so much, Dina. And what brings you in today?
Just annual checkup.
Perfect. So we're going to ask you a series of questions during this checkup. So bear with me. I'm going to start off by asking you if you can also verify your age, gender, and race, ethnicity.
I'm Romanian, 31 years old.
Thank you. And do you live alone or?
I do.
And are you here alone or someone today?
Yes, I'm alone.
And are you able to provide accurate information about your health?
Yes.
Perfect. And do you feel safe?
I do.
Okay. You said you were here for an annual checkup. Is there anything specific you'd like to visit in today's visit? Okay. And you don't have any issues or anything that's happened to bring you
No
today?
concerns.
Gotcha. Okay. When was the last time you had an annual exam?
It was a year ago.
Any issues then?
No, no issue.
Has there been any changes since your last exam?
As far as I remember, no changes.
No. And are you updated with any of your vaccines?
Yes.
Okay. Did you do your flu shot?
I did.
Okay. When was the
Last one was last year.
Okay. So you're up for a flu shot. We do offer it should you be interested. It is flu season now, so we can get you protected.
Sure, sounds good.
Perfect. Thank you so much. Once we're done, I'll put in the orders for you to get that done. Have you had your COVID vaccines?
I have.
And your booster?
Right, yes.
Perfect. And HPV?
Yes.
Beautiful. Thank you so much. Have you ever been in the hospital or hospitalized?
No.
Have you had any recent falls?
No falls.
Okay. Any surgeries?
No surgeries.
No surgeries. Okay. And you are female. I wanted to ask about your menstrual cycle. When was the last time you had
Last
it?
time was 10 days ago.
Oh, perfect. And are your cycles regular?
Yes.
Do you have any pain, cramping, tenderness?
Not really.
Okay. Have you ever been pregnant?
No.
No pregnancies. Are you sexually active?
Yes.
Are you on birth control?
No.
No. How many partners do you have?
Just one.
Okay. Thank you. Are you taking any medications?
No medications.
Any supplements? Vitamins? You do? Which ones?
Vitamin D, magnesium.
Okay. Okay. Do you know the doses by any chance?
No.
Okay. Do you have any allergies?
No allergies.
No allergies to anything? Perfect. I'm going to ask you some questions about your family history. So this is about your parents, your grandparents, immediate family. Has your mom or dad ever had any health conditions?
They do. My mom has hyperlipidemia.
Okay.
My dad has high blood pressure.
Okay.
And my grandmother, she had colon cancer. She passed away 2 years ago.
Oh, I'm so sorry. Was this grandmother from the mom's side or the dad's
On
side?
my mom's side.
Your mom's side. Thank you so much. I'm so sorry for your loss. Do you have, and you mentioned your grandparents, I was going to ask you about your grandparents. Do you have any, do recreational or illicit drugs?
No.
Okay. And are you married, single, or in a relationship?
In a relationship.
Okay. And you have a good support system at home?
I do.
And then I asked you about that. Do you use any type of condoms or other contraceptives?
No.
Okay. Any past histories of sexual transmitted diseases?
No.
Are you planning on getting pregnant or are pregnant?
Yes.
Perfect. What do you do for work?
I am a psychologist.
And have you ever served in the military?
No.
What is your current living situation? You said you lived alone. Can you describe your typical diet and activity level, please?
It's a poor diet, I would say. I don't work out, and that's bad. Yeah, pretty much.
Okay. How many do you eat any vegetables or fruits?
Not really.
How much water do you drink a day?
Just a glass of water a day.
Okay. How's your sleep?
I sleep 7 hours a day.
Okay. Do you have any spiritual or religious practices?
Yes.
Okay. What would that be?
Sunday, visiting church, yes.
Thank you so
Sundays.
much. And you said you felt safe at home?
Yes, I
And
do.
then do you have smoke detectors or fire?
I do.
Perfect. Do you own any firearms?
Yes.
Okay. And do you need help with any of like daily living stuff like dressing, shower, daily tasks?
No.
Okay. Have you had any weight changes?
No.
Any fatigue, fever, chills?
Fatigue, I would say.
Okay. When did the fatigue start?
It's on and off.
Any vision changes, redness, pain?
No.
What about hearing loss, congestion, sore throat?
No.
Chest pain, palpitations, swelling of the legs?
No.
What about nausea, vomiting, constipation, or diarrhea?
No.
Do you urinate regularly?
Yes.
Do you have any pain during urination?
No.
No burning sensation?
No.
What about blood?
No blood.
Okay. How about joint pain, stiffness, weakness?
No.
Do you have any rashes or changes in your skin?
No.
Okay. Do you get headaches?
No headaches.
Do you feel dizzy, numbness, or weakness anywhere?
No.
Okay. How about depression, anxiety, and stress?
No.
Any mood swings?
No.
Okay, what about heat, cold intolerance, excessive thirst, or urination?
No.
Okay. Do you bruise easily?
No.
Swollen glands? And seasonal allergies, frequent infections. You said you didn't have seasonal allergies. What about infections?
No infections.
Thank you. Okay, so after going through your family history and a thorough assessment, you are a little bit at high risk for high blood pressure, and you said your grandma passed away from colon cancer and high cholesterol, which is called hyperlipidemia in this instance. And you said you don't eat a lot of fruits and vegetables. So I do recommend for you to get maybe a colon screening when you have bowel movements. How does your bowel movements, how are they? Are they frequent? Do you feel constipated?
Yes. Yes. Constipation. I got constipation. I wouldn't say it's regular.
Not regular.
Bowel movement.
Okay, and then do you have any blood in the stool at times?
I haven't noticed, no.
Okay. Okay, so and because you have constipation and a history diet or maybe like any other, because that's fiber, and fiber will help you with the constipation. And it'll also, what I do recommend is for you to do a colonoscopy, because you do have this history, so we want to make sure if you do have any polyps, you know, we can find that and we can take care of that before it goes any further. Also, with blood pressure, there isn't any symptoms per se to feel. It's kind of like a silent disease initially. So I do recommend for you to get like a blood pressure machine and take your blood pressure frequently. And if you can just record that, and then we can discuss the findings during our next visit. I did notice that your vital signs were a little bit elevated to my liking. It was 140 over 85, and typically our norm is 120 over 80. Anything above that is a little bit concerning. But I do understand that you were at the doctor's office, so I don't know if you were nervous or you know, I know a lot of people don't like to come visit us. But what we'll do is we'll monitor that, and if you walk a little bit and introduce these fruits and vegetables to your diet and kind of eat more. Do you eat fish at all?
I do.
Great. So keep up with the fish, keep up with the lean meat, and put in some exercise. And if you can just take your blood pressure readings, please. I do want to see you back